The main stages of soft tissue healing include acute, which initiates shortly after the initial injury, subacute, which begins within days and includes the major processes of healing, and chronic, which may last for up to a year and is responsible for scar tissue formation and the development of new tissue. You should read Chapter 5 regarding the specifics of each stage of wound healing. So the guidelines for treatment in acute phase are achieved by using the principles of Price-MEM, which is protection, rest, ice, compression, elevation, manual therapy, early motion, and medication. The goals are to decrease early bleeding and facilitate the removal of the inflammatory exudates, which can prevent further damage and inflammation to the area. And again, refer to Chapter 5 regarding specific interventions that support these goals. During the subacute phase, this stage is characterized by a decrease in pain and swelling and an increase in pain-free active and passive range of motion. It will be important to emphasize to the patient that an overly aggressive approach during this stage can result in a delay or disruption in the repair process through an increase in the stimulation of the inflammatory chemical irritants and exudates. And during the chronic or remodeling stage, this time is characterized by a progression to pain-free function and activity. And the goals will be improving muscle strength to normal levels, returning to normal neuromuscular control, completing a full return to functional activities, and restoring normal muscle force-couple relationships. Again, be sure to review this information in Chapter 5 of your text.